welcome. My name is Ejo and welcome to Koforidua Today. Koforidua Today is a program that seeks to throw more light on the Eastern region, basically on the various issues rising from the Eastern region, be it health, education, entertainment, anything that you think about that is happening in the Eastern region. We want to project the Eastern region as one of the best hubs or business hubs in the region, or in Ghana for sure, because Eastern region has a lot to offer. So this first edition, we're talking about health. And the health we are going to talk about is based on the current novel coronavirus that is taking a sweep at the whole world and causing a lot of disrupt in various business sectors. But before we begin, I'd like to acknowledge Profile Foods from Brown for sponsoring us, and also Safe Gold Hotel for giving us the venue. So before I begin, I'd like to introduce our guest, who goes by the name Dr. Jed Appiah, who is a dentist of the Koforidua Regional Hospital. So welcome, sir.
Thank you very much.
Thank you for honoring our invitation.
It's a pleasure.
For accepting to come on board on Koforidua Today for the first edition.
That's fine.
All right, so before we begin, I'd like you to tell us a little bit about yourself so that people get to know who we are talking to.
My name, like you rightly said, is Dr. Jed Appiah. I am a dental surgeon at the Eastern Regional Hospital, Koforidua, and I'm also a Christian, and I'm very proud of that, and I like to mention it wherever I go. And I fellowship with the Church of Pentecost, PIWC Koforidua. Yeah.
That's nice. Thank you so much. For the sake of this interview, I'd like to base it mostly on the coronavirus, which is the COVID.
Okay.
That is really, really causing a lot of disrupt in the system. Every sector is affected by this virus. So we want to throw more light, especially from the Eastern point of view, the Eastern region point of view. Okay. We have the general, the Accra, the world, Ghana, but we want to take it from the Eastern region since we are based in the Eastern region. So first of all, can you please briefly explain what this novel coronavirus is all about?
When we talk about the coronavirus is a family of viruses. It's a broad family of viruses that scientists have given that name because of the way they appear under the microscope. They appear having things like spikes pointing out of the virus, and because of that, they said it's a coronavirus, and corona means crown. So because of the spikes, it looks like a crown, and that's why they call it a coronavirus. Oh, wow. Now, it's a number of viruses, and what we have now is not the first of its kind. In the Middle East and Far East, there have been other coronaviruses that have been causing a lot of problems, like MERS. There is something we call MERS-CoV, Middle Eastern Respiratory Virus. That's also a coronavirus that causes a lot of things. And then we also have the SARS, severe acute respiratory syndrome, which is also caused by a type of the coronavirus. But what we have on our hands now is a new type of the virus, because SARS and MERS have been in the system for quite some time. And so health scientists and health experts have been able to find out ways by which we can deal with it. But what we have now is a new type of the virus that appeared first in a province in China called Wuhan. The first person to get it was ill on the 1st of December 2019. That's when he reported sick. And it's a new type of the same coronavirus. It has that same appearance under the microscope. But because it's a new type, now the treatment modalities that have been used to treat the other types of the coronavirus, like SARS and CoV, do not necessarily apply. And it is showing different patterns and slightly different we call them presentations, as in the way the symptoms appear in people. Yeah. So it's not like coronavirus is a new thing, but what is new is the type of coronavirus that is now a pandemic, which we actually call SARS-CoV-2 or COVID-19. Yes, so that's about the coronavirus.
Thanks for the education. I really didn't know corona meant a crown or something, but thank you for the insight. Now, we move on again to the fact, what are these? We've been hearing the symptoms of coronavirus all the time. Okay. And what are the major symptoms that, because, for example, I might have it, I'm sitting here, but you might not know, or something. So, apart from the major symptoms that we know, even though we have to talk about it, what other signs can help us identify the virus?
Okay, so we are entering something in health we call diagnosis. For COVID-19, the best form of diagnosis is the lab test. That is how you can be sure when you are tested. That's how you can be sure that you definitely have the COVID-19. Because a lot of the symptoms mimic symptoms of other diseases. They even mimic symptoms of common colds. And so you can't just sit down and then develop a sore throat and think that, hey, I've got COVID-19. No, it probably is just a strep throat or a strained throat or whatever, or you just have a normal common cold. Now, it will interest you to know that it's about 80% of people with COVID-19 are asymptomatic, and that's what makes the disease very strange. When we say asymptomatic, we mean that they don't show any symptoms at all. They are living normal, healthy lives. And until they are tested, they won't know that they have the disease.
Like yes.
Yes, so you could have it. And that is why we need, well, we'll come to the protocol, because that's why we need to observe the protocol strictly, because anybody can have it at all and you will not be able to tell. The person will be living a normal life and will be spreading in the community till someone with an underlying comorbidity gets it and gets a severe illness, and then unfortunately happens to the person. Now, the most common symptoms that scientists and researchers have found out are cough, a sore throat, and a fever. Cough, a sore throat, and a fever. So these are the common symptoms. But other symptoms, and they range from places to place. Other symptoms include an acute loss of the sense of smell and a sense of taste, tiredness, diarrhea, a sore throat, and a myriad of other things. Yes, there are always new things coming up. In fact, a lot of the autopsies have revealed that people who die as a result of the COVID-19 die because of blood clots that form and flow to the lungs, something we call pulmonary embolism. And those ones, they can also, because if you have clots in the system, they can also present with so many complications and other symptoms. Yes, so it's something that researchers are learning a lot about. Yes, but like I said, the most common symptoms are the fever, the cough, and then the fever, the cough, and then the tiredness. Yes, please, that's one. Yeah.
Right, thank you on that point, and I think the point is well noted. COVID-19 spreads. Mm-hmm. How does it spread? And secondly, why is the spread so quick? Because within a split of a second, you might just get it into your system without even knowing you've done it. It's so quick and so fast. How does it spread, and why is the spread so rapid?
COVID-19 spreads through what we call droplets. Okay, so droplets, as we speak, when you look at someone, there are videos of people sneezing, and when you see those videos in slow-mo and they sneeze, they release what we call droplets. So that's how the virus spreads. It also spreads through aerosols. So droplets and aerosols. And that's how it spreads. As to the reason why it spreads fast, there are a lot of things that go into the spread of a virus. In a flu season, people get the common cold. You see, it's just like I said, it's just like a normal common cold. And just like when the flu season comes, a lot of people get colds. It's the same thing. Just that this is novel. And so for a lot of people, since the virus is a new type, people have not built an immunity to it. And that's why people are getting more and more infected. Also, there is not a vaccine. And then this is one of the type of viruses that disrupts communal life. Because, if this was a normal day, I'm sure would have been closer, would have shaken hands and things like that. But that is the mode of spread. And so in places where people are still living as communal as they were living before, the virus spreads quickly.
Okay, yes. Thank you so much. And for you guys, we are a meter apart, so don't think we're close. All right, so moving on to the next question that I would like to know is, we've heard about the education going on coronavirus in various regions, how they are tackling the spread and educating people about its effects and the symptoms and what coronavirus is all about. Now let's come to the Eastern region. How are we spreading the news? How are we educating? So how is the education like in the Eastern region with regards to the COVID-19?
All right. So in the Eastern region, health promotion is actually a very big thing. And in fact, at the hospital where I work, it is mandated for the hospital to embark on health promotion activities. Even in the OPD, when you come to the hospital, you are educated on the virus and the measures you are supposed to take. And apart from that, the hospital and other health institutions in the region go into the villages, into places where they will not, they are not likely to hear because maybe they don't have televisions or they don't have social media, to educate the people and tell them that there is a new virus in town, and so you need to watch it. And so there's a lot of health promotion going on thanks to the Regional Directorate of the Health Service and then the hospital's own initiative.
So meaning, if we get it right, the education is going down to the grassroots, the
Yes,
community.
it's going down to
so
the
now
communities.
community-based education
Yes,
is being taken
yes,
place.
yes.
So I think the records of Eastern region cases are not so high so far. I think we are around 100 and something or 200.
So yes, we've crossed a little over 200.
Okay.
Yes.
So I guess we are still trying to. Okay. So my next question is, we know COVID-19 has affected different aspect of the economy. Whatever aspect it is, it has disrupted everything. So how has this pandemic actually affected the healthcare delivery system in Ghana?
All right.
In the Eastern region, precisely.
It has affected the healthcare system very, very heavily. I'll start by talking from the dental aspect and then move. Now, if you remember, I said that one of the modes of spread is aerosols and droplets. Now, in the dental setting, a lot of our procedures generate aerosols because we spray water at a high speed on the mouth. And really, well, this is a little technical, but a lot of the virus is deposited in the salivary glands. Research has even shown that long after patients have recovered, there is still some of the virus in the salivary gland. And so, like I said, we don't know a lot about the disease. So people are beginning to say that, is it possible that people will be testing negative and yet because it's in the saliva? I mean, we don't even know if you can get it through kissing and all of that. Yeah, so we are all researching and studying, and as time goes on, we'll get to know. But because our procedures are aerosol generating, and we know that there's the virus in the salivary glands and all of that, we've had to stop a lot of those procedures. In other places, they have, like the US, they have mechanisms that get rid of the aerosols. They have things like rubber dams and high-tech things that reduce the ability for the disease to spread. Unfortunately, in our part of the world, we don't have access to all those things. And even if we had access to it, people will not be able to pay for those services exactly. So we've had to cut down on all those things and limit ourselves to emergency services. So it is placing a burden on, because now people who need fillings would have to stay at home till probably the hole in the tooth gets deeper, and then they come and take it off, as we seek to resolve how best we can resume normal work. Apart from the dental set and other facilities, in fact, when the disease came first, we had to a lot of OPDs in smaller hospitals had to close down because they didn't want people flocking into the system and then coming to get the disease in the hospital. And so a lot of OPDs had to shut down, and people were not running what we call elective procedures. Somebody wants to get rid of tummy fat. They want to go and do a liposuction. Because of COVID, some of these things were being cut down. Somebody has a procedure they have to do, like a hernia, for instance, and then the doctors will tell you that, look, your hernia is not going to kill you, so stay at home with your hernia, adjust it with your belt. And so it's caused a lot of inconvenience. And what I've even noticed, and what I suspect, is that a lot of people, because hospitals are not offering certain services, they are staying at home till their conditions worsen. And then they come late stage, and it's really worrying us. And so we really can't wait for research and science to show us the way out and a vaccine to be developed for us to get back to our normal style of living.
Wow. And I guess our Ghana Health Service has a lot of things to do in terms of how to tackle the coronavirus, because it has affected the only source where we can get the treatment from. Then I guess we are in for a long ride, because we don't see the end of this COVID anytime soon. So that brings my next question, which is how do we since the virus came to the country, it has been spreading and all that, are there new policies that have been added to the health delivery services so far that are helping combat the COVID-19?
Yeah, interesting. Okay, so this is pretty much like taking off where we left from. So like I said in the beginning, when the disease came first to Ghana, we had to cut down on a lot of OPD service and everything. But as time went on, we realized that we could not keep that up, because you can't say that you are stopping a hypertensive clinic because you don't want to get infected, you don't want to infect other people. The people with hypertension will develop other conditions which will worry them. So because of that, we had to reinforce what we call our infection control and prevention measures. Now, the hospitals are a place where every sick person comes. Even though COVID-19 is a new thing, there have been other viruses, other bacteria, other germs that can also be transmitted from one person to another. And so because of that, the hospital settings have developed very robust and very rigid systems that prevent spread from one person to another. from a patient to another patient, from a doctor to a patient, from a patient to a doctor, and from the hospital to the community. So it's called infection prevention and control. This is not something that is new to the hospital setting, but because of the coronavirus that has come, we have had to reinforce it. Because in certain areas, there were certain things that were taken for granted and people were not really bothered about it. But now, because we have this in our hand, it has made us just revise and be more strict about our infection prevention and control, which includes things like washing hands after seeing every patient, making sure that you are wearing the appropriate PPE, your nose mask and your hair cap, and many other things that are pretty much technical. But like I said, we've had to revise and be more strict with our infection prevention and control measures.
Thank you so much for that. And so when it comes to handling of the COVID-19,
Okay.
do you think our health facilities are capable, have the capacity to handle this pandemic as we think? Because we keep seeing the rise in numbers of cases, even though the active cases are still, let me say the active cases are still going up.
Yeah.
They're still.
Yeah.
We are almost 11,000 cases now. So the pandemic is still going on. It's still increasing. The health facilities are still working. They're still receiving people. Do we, as the Eastern region, into the Eastern region, are we capable of handling such insurgencies?
Okay. This is a dicey question. Because you can only know whether you are capable of doing something or not when you fully understand what you are dealing with. Here's the case where the whole world, we don't understand what we are dealing with. Okay, it has taken Spain down. Yeah. It has taken Italy down. It has taken America down. It took Iran down, and it's taking Iran down again because now there's a second wave of the virus in Iran. So it would really be daring on my part to come and say that Eastern Region has got Eastern Regional Hospital and the facilities here have got it under control. But then again, I know the expertise that we have at the hospital. I know how this hospital treats its patients and give them the best of care. In fact, a lot of patients come all the way from Accra just to receive treatment at our place. All I can say, that's the Koforidua Regional Hospital. And not only that, we have one of the best orthopedic hospitals in Ghana, St. Joseph, and many other hospitals littered across the region. So what I can say is that we are trying our best. And it reflects in, even though you cannot say that the treatments should bear down on the number of the rates. Yes, because the rate is really the rates increases when the people in the communities are not adhering to the measures that they are supposed to adhere to. But the hospital is doing its best in treating the patients based on the research findings that we are getting and based on the new things that are coming up and what we are finding out. The hospital is on top of its game. Currently, this is a bit private, so I cannot, but I know that the mortality in this region is pretty low, and the hospital is on top of its game in that regard.
Well, thank you so much. Now, coming to the point you just made, where if the cases are increasing, it's because the community or community spread is now going high because maybe people are not adhering to the various protocols. Now, are these protocols enough for us to adhere to? Because it seems people have gone back to work as if life has returned to normal. The market women are in the market doing what they want. No nose mask, no hand sanitizers, no social distancing, and all those things. It's like they've forgotten about the virus exists. So these protocols that we were given to follow, are they enough?
Another interesting question. I think this interview session is full of very, very interesting questions. And I think that this question is interesting because the protocols, I've heard of so many protocols. People are speaking out of paranoia, irrational fear. People are speaking out of selfish interest. And people are actually also speaking the truth. Based on the research that we have, based on the research that the scientists have come across, the protocols that are laid out by the World Health Organization are enough for now. I'm choosing my words very carefully. They are enough for now. But the adherence to the protocols is abysmal. You see, the protocols are enough. The measures that they've put in place should really work. But because people are not really adhering to these systems, then that is where the problem is. I don't know if you understand. So yes, the protocols are enough, but the compliance is a problem. It's a problem for us.
So that means if the compliance is a problem, adhering to the protocols is a problem, I think we are far from calling it normalcy anymore, because if you and I are not adhering when we step out there to the protocols, meaning we are at risk of spreading or
contracting,
getting infected with the virus, and we also spread it more, which means we still have a lot to do as a region, or as a country together. So now my next question is, how well has the region prepared for the pandemic? Should it overcome us? Like, let's say, should it come like a wave?
Okay.
Or let's not even say the wave, but how well are we prepared?
Okay.
I think this has been answered in a few of your but how well, like, should it happen that Eastern region is recording cases on an abysmal level, how well are we ready to tackle these things? Do we have isolation centers ready? Do we have enough health personalities to tackle contact tracing, rapid tracing and all those things, testing and all those things? Do we have everything in place?
I can confidently say that yes, the Eastern Regional Hospital has what they need to be able to handle the disease. Because yes, we do have the isolation centers, yes, we do have the health personnel adequately trained to handle it. And I mean, based on the research and what we know about the disease, yes, we do have the isolation facilities, yes, we do have the health personnel, yes, we do have the people who do the contact tracing. As for that one, it's not even, I don't think it really comes from the region. I think it comes, there is a center that's responsible for the contact tracing and all of that. So yes, I think that the region is adequately prepared. And it tells, I mean, our number of cases, when you compare it to the number of cases in the country, we are not doing bad at all.
Oh yeah, that's very true. I think yesterday I saw the numbers. I think previously we were the third region with the highest cases. I think now we are the fifth also, meaning at least, even though the cases are coming, but they're not coming in as rapid as they used to before. So now, with regards to the health personnel that we have, who are the frontline workers, who are the first line of contact and all those things, do we have a system where, because I believe even in a normal environment of work, when you work continuously for a long time, you get fatigued, you get tired, or when those people taking care of the people in the isolation centers and stuff, do they run shift systems? Are they taking care of well? Do they have enough? Let me join the question. So are they running a shift system whereby they can rest enough to be able to take care of the next people? And secondly, does the region have, the regional hospital, all the health facilities in the region have enough PPEs to protect them from contracting the virus?
When it comes to Ghana as a country and the number of people in the country vis-a-vis the number of health personnel we have, health personnel are overburdened. It's not even Corona that is bringing that problem. Okay, health personnel are not adequate to meet the population that we have. So we need more health personnel. And I haven't said that in the isolation centers, yes, there are enough health personnel who are being trained, who make sure they don't overwork. Because when you overwork and you get fatigued, your judgment is impaired. You actually begin to skip over protocols and things, and then your risk increases. So there's that. Now, it's not every hospital in the region that has an isolation center. Okay, it's not every hospital. There are designated hospitals in the region that have isolation centers, of which the Eastern Regional Hospital in Koforidua is one. However, like normal running of the hospital, they need PPEs. And yes, there was a time where there was a shortage of the PPEs, because a lot of these PPEs come from China. Yeah, and there's a shortage of masks and many other things because now China is not supplying. However, a lot of local companies are supplying the masks and things right now, and so the situation is really improving.
Okay, so we could say we have enough PPEs to protect.
Yes. We are getting there. We are getting there.
All right, viewers, if you're doing the listening or watching this program, we're recording it live from Safegood Hotel in Koforidua. They are our partners, our venue partners for this Koforidua Today program, and we'll be sponsored by Profile Foods and Profile Tom Brown. Trust me, in these COVID areas, you would need Tom Brown on the go. This is Tom Brown on the go. You don't need to necessarily cook it. You just add your water and you mix it, and you're good to go. So, as I said, grab one. If they are located in various shops around, you get them. Profit Foods, Profit Unbound, then Safe Good Hotel in Koforidua. So once again, welcome to Koforidua today. So we continue with our interview as we said. So Dr. Jed, now do people still visit facilities like they used to, even though the restrictions have been reduced in a way? Do people still visit health facilities for normal healthcare services?
All right.
Unlike before when they were told to, hey, stay home, don't come. Now things have been reduced. I think, the protocols have been set in place if you want to visit the hospital or something. So do they still come in the numbers to check their normal health status?
Yes, the condition is improving. Like the president said, we've got to return life to normalcy. And so over time, I've noticed that the number of OPD attendants, it took a sharp decline, but now it's beginning to improve. And so yes, a lot more people are beginning to turn in our OPDs to seek healthcare.
Okay. All right, so being a health personnel, how has this pandemic really affected your relationship with people and your loved ones and work and everything?
Being a health personnel, it's because our work is in close contact with people, and most of the time we don't know their statuses. You have to treat yourself as somebody who has been possibly exposed, which means that you have to limit communication and contact with other people. I remember recently I went to my grandfather's place, and under normal circumstances we'll go in for the hug. But now I'm actually scared for him. So it even has an emotional burden on us. I mean, we especially have to put in stricter measures, if I can say, to make sure that we don't become focuses of spread to the community.
Because I also know that ever since this pandemic came about, I've not really been to places I used to go often. Even Accra, I don't remember the last time I went to Accra.
It's not easy.
I just want to stay safe.
Yes.
You know, someone might laugh at you that, hey, Usuru, but this is not something we talk about Usuru or something. This is a very serious pandemic. You know, because I might have it, you might not know I have it.
Yes.
I might meet you, you might have it, I might not know you have it, and I might not know where I might get infected from, or where you might get infected from.
Yes.
So why take the risk? If I have nothing doing, why would I come?
Yes.
So I think people out there need to be very strict on themselves. Just follow the procedures, and we all stay safe. Who knows? Maybe in the near future, this thing will be over and done with. So I think I'll just advise everyone as we are doing the interview that please, if you have nothing doing out there, don't go out. If you have something to do, you know the procedures. Wear your face mask, hand sanitizers. When you get to a shop and you're entering, you touch something, make sure you wash your hands with soap and running water, and your mask always on. So please, let's adhere and let's stay safe, because Koforidua today will not be possible if you are dead. Now you can't say by June, but we are hoping say by June doesn't happen. So let's all practice all these things. And notwithstanding, I would like to say thank you to RNF Photos, who have been our partners, and Mighty TV for making this possible, this interview possible. So they have been our partners since. So if you need any services from them, especially RNF Photos and Mighty TV to cover your event, take photography shots and everything, please don't hesitate to contact them. So anyway, back to business. So Dr. Jed, I think we have I think one or two questions, then we are done. So what's the way forward now in terms of the pandemic and health delivery system?
Okay, what's the way forward? The way forward is this research, because the more we know, the more we are able to prepare adequately for the disease.
Sure.
So research is one of the key ways forward. For the doctors, as research rolls out, as we continue to be strict on, as for health personnel, as research rolls out and as we continue to be strict on health, on infection prevention and control, we are coming to the point where the healthcare system is almost returning to normal.
Okay.
Yeah, we are almost there, especially in the dental setting. We are gradually introducing measures that will bring us to that point. But like I said, a lot depends on the community. The way forward is that we stick to the measures that have been put in place, especially by the WHO. And maybe you give me the chance to just go over them briefly after,
please.
Or I can do it right.
Continue,
All right.
because
Yes.
it's
So
also part of the way forward.
yes.
Let's talk about it.
And so, like we said, the COVID-19 spreads through droplets. The closer you are to a person, the higher the chance of you contracting the disease. Droplets spend some time in the air as well. And so it's not like the person sneezes and once the sneeze is over, it's done. The droplets can stay in the air for some minutes. And so someone will sneeze and leave a scene, and you know that someone has sneezed, but the droplets are in the air. You pass through that place, and then you get it. And that is why we have advised that as much as possible, when you step out into places where you cannot observe the social distancing enough, please go with your face mask. Then we've also said that frequent hand washing, because it's a respiratory virus, and it goes through our nostrils and through the mucosal surfaces, and our hands are the culprits when it comes to the parts of the body that touches the face a lot. And so as much as possible, you'd want to wash your hands. As much as possible, you also want to use hand sanitizer. Wash your hands under running water with soap. These are the two main measures that can and will protect you. And then please stay at home if you don't have anything to do in town. A lot of people are asymptomatic, okay, and you won't know that they have it. And you may get it and you will know that you have it till you give it to a family member who would not survive the disease. And so if not for your own sake, for the sake of someone you love, please stay at home if you don't have something urgent to do. And stick to the protocols. Yes, it can be annoying, but as much as possible, please wash your hands under running water and with soap. And wear a face mask as much as you can, especially when you are in crowded areas, when you go into shops, when you go into places where it's difficult to observe social distancing. Please and please again, wear your face mask.
Let us adhere to the protocols. Trust me, the protocols are going to help us. These protocols are going to save our lives. Save me, let me save you. Wear your mask or sanitize your hands when you step out, because you need that to happen so that I can also stay alive and I can also protect you as well. So what are your final words as we come to the end of the interview?
Okay.
Your final words to everyone there, any advice or patients and everyone?
All right. First of all, I'd like to thank you for having me on the show. It's been a pleasure, and it's been nice talking about this thing. And I know that it's very educative for people. And my final words are: do not be afraid, because coronavirus is not the first pandemic, and unfortunately, it's not going to be the last pandemic to hit the world. And there have been worse pandemics that the world has survived, and we'll get through this. Nonetheless, we need to also know that diseases don't come and leave just like that. They come to stay. And when they come, they mean that we need to alter the way we do things. When the HIV came, it's altered the way a lot of things were done. When Ebola came, it altered the way a lot of things were done. In the same way, the novel coronavirus will alter the way things are done. But we need to be disciplined, and we don't need to be in a haste to get back to life as it were. Life may never be the same, or life may return to normal. But for now, we need to adhere strictly to the protocols that have been outlined. Let's also beware of people who are spreading rumors and things that are not verified, because these things no, let's stick to what the health organizations have come out to say, and stay away from a lot of these rumors, because you should know that a lot of people want to just rip you off and make money out of you. Some of the heinous things people are saying, people have even gone to extents of saying you find hair in Bible and drink and you get immunity. That is ridiculous. And they are just playing on your ignorance. Please. That's why I started by saying, do not be afraid. Now, we'll get through this. And I know that a lot of people are being affected economically, and a lot of people are tight. In these times, just relax, stay calm, maybe cut down on your spending and all of that. And begin to also, in your small corner, try to research as to how you can improvise and put or bring on board things that will also help limit the spread. If you're a barbering shop, you may want to have a Veronica bucket in front of your shop, and stick to more strict infection prevention and control. Then people will have confidence in you and also patronize your goods. We know that definitely, coronavirus has come to stay, unfortunately, but it will not take us down. Definitely. Yes, it will not.
Well, those are great and powerful words by our guest, who has been so exceptional with this interview, and we thank him for coming through. So Dr. Jed Appiah is a dentist at Koforidua Regional Hospital. So anytime you're around and you want your dent to be checked, I don't know if it's a correct word.
Your dentition.
You want your teeth to be checked, you can just pass through, and I'm sure it's going to afford some time with you and treat you well. But all the same, we would like to say thank you for watching this program. Thank you for being our first viewers of this program. We appreciate you. Koforidua today has come to stay, just like coronavirus, but Koforidua today is more stronger than coronavirus.
Yeah.
So definitely, we're going to go more. So watch out for the next episode that will be coming on in some few weeks to come, where we'll tackle another health aspect or any other topic related to the Eastern region. So once again, we'd like to say thank you to Safe Gold for hosting us, Safe Gold Hotels in Koforidua. We'd like to say thank you to Dr. Appiah. We'd like to say thank you to Profile Foods and Tom Brown for sponsoring us for this episode. And we'd like to say thank you to our able guys, RNF Photos and Mighty TV for the amazing work that they've done. So please, thank you for your time. Let's stay safe. Save me and let me save you. Wear a face mask and let's protect ourselves. To Koforidua today is an AJ Woods Media production. It's an initiative by AJ Woods and it's powered by AJ Woods Media. I'm AJ Wills and I say thank you. Bye. All right, we're going on the streets now to go interview people and talk to them extensively to know how COVID-19 has affected their various businesses and livelihood. So watch out for the street interviews as we step out. Thank you very much. All right, once again, this is Koforidua today. My name is AJ Wills and we're on the streets. We're trying to find views of people with regards to COVID-19, how it has affected their various businesses and their livelihood per se, because most businesses are even laying workers off. Some have even tried to come back to normalcy. So we are just on the streets trying to ask a few questions to the normal Ghanaian out there to know what they have, how they have been affected by the COVID-19. So I'm here with the CEO of Profile Foods and Tom Brown, who has been so, let me say, amazing with Koforidua today, and we thank God for him coming around. So we would like to ask him just a few questions about the COVID-19 and how it has affected his business and everything around him. So my boss, welcome.
Thank you very much.
All right. So you tell us your name.
I am Prince Akufu, the CEO of Profile Foods. We basically produce Tom Brown. For now, that's our main product.
All right. So what makes your Tom Brown different from the one on the market?
Our Tom Brown, all you need is water. You know, mostly for Tom Brown, you have to cook for some minutes or something. But there is a Tom Brown made on the go for you. So all you need is water. You can choose to cook. You can choose to add water and sugar, then you are good to go. And the taste is perfect. And in times like this, you know, you have to eat good and you have to eat well. So healthy food and Profile Foods is there for you.
Healthy food indeed, and Profile Foods is there for us. So now coming back to the main purpose of the questions we want to ask, COVID-19 has come to disrupt a lot of companies. A lot of institutions are going bankrupt. A lot of people are being laid off. The hospitality industry has been affected. The transport. We can name on and on and on and on. Now, how has this affected you in terms of business-wise?
For COVID-19, it has really affected everybody. Not only businesses, but everyone. There have been a lot of limitations in terms of the things that we do. Production has gone down because we have to observe protocols, and what we do, social distancing, is not something that we have to really observe before COVID-19. In terms of sales too, you know, we do go for storms and other stuff, but now no programs, no shows. We don't go to schools to sponsor them. We don't get those opportunities, so it's really affected us. In terms of production, as I said earlier on, we do ship most of our things from outside our borders, and now due to the limitations we are having difficulties, but in a way we have to find solutions to it, and we have to leave and we have to come out, so we are working on that.
All right, you're working on it. So what's the way forward in terms of restructuring yourself? How are you dealing with COVID-19 as a company, and what structures have you put in place to maintain your productions and the people you work with?
Yes, we have really put structures in place because COVID-19 has come to stay for now. It's something that we are going to live with it, and we have to go and we have to move on as a business. And as a result, we first started with fumigating our facilities, which was very, very important. You know, our product has been certified by the Food and Drugs Authority. We had approval from Ghana Standard Authority, and before you can get all these, you have to do what? Fumigate your facilities and everything. So we've worked on that. Our facilities has been fumigated, and also in terms of sales, we are observing protocols as the government have brought out. We are working on that. We have worked on that, and we are moving. And again, we are, as I said earlier on, we are waiting for schools to resume and everything so that we can sponsor them, and we go there too. We are putting things in place to observe the protocols that the government have brought out for us.
All right, thank you very much for your time.
You're welcome.
All right, so you heard him. He's the CEO of Proper Foods and Tom Brown, and he's saying that they've put on the COVID-19 has affected their business in many ways. So we know it has affected you and has affected everyone around. So you will get to hear more insight on the streets of how the COVID-19 has affected people. So watch Koforidua today as we bring you live and interesting issues surrounding the Eastern region and Koforidua. Thank you very much.